Okay, I think we might be ready to begin. Can I just turn to my co-host, Belinda? Get an affirmative. Are you ready to begin? Hello. Good afternoon.
Hi.
Good morning or good evening.
Good afternoon. I'm in Johannesburg, South Africa. Nice to meet all of you.
Nice to meet you too. I'm looking forward to the discussion this afternoon, where we'll be talking to fellows from the Chatham House African Public Health Leaders Fellowship about the new paradigm in Africa on public health as a result of COVID-19. They're from many different subject areas, working in different organizations, at different viewpoints. So I think we'll get into lots of interesting areas of discussion. Isn't that right, Belinda?
Yeah, absolutely. I mean, the projects that you're working on, the disease areas, it's just amazing. And I'm looking forward to hearing your insights and how we can move this continent forward with young people like you.
Yeah, amazing. Well, why don't we just do a quick round of introductions, just so everyone on the call knows who we are. Perhaps Belinda and I can start. So I am Ade Adeyemi. I am Director of the Fellowship Programme at Chatham House. I also work for the Department of Health and Social Care for the Government of the United Kingdom on bilateral relationships in global health. And it's a real privilege to be with you all guiding this discussion. Belinda?
Sure, thanks, Ade. My name is Belinda Budu. I'm with the IFPMA as a secondee. I joined them in April, but I've been in the pharmaceutical industry for more than 20 years, working in various different areas, mostly based in South Africa. I work for Eli Lilly, which is a company based in the US, and work in global health currently, and joined the IFPMA as a secondee in April, working on various different projects on the African continent.
Thank you. And it is worth saying a quick word on IFPMA, who's a great supporter of the fellowship program. Without their support, we wouldn't be here. So we're very grateful for them, and Belinda, very grateful to have you working closely with them as well for a short period and supporting us on this engagement, as it's not just a short-term medium thing, but a very long-term engagement and partnership we've had so far. Let's have a word from our fellows before we then narrow down to one or two of them. If we could just have a very quick 1-minute introduction to yourselves, where you're calling from, and then when we come to you later in the program, we'll go into more in depth about your views and experiences of COVID-19 so far. So we'll do it in order of on my screen here. I'll go to Valerian first, then Adesola afterwards. Thank you.
Thank you very much, and good afternoon, everybody. Nice to be here. Nice to join this discussion. My name is Dr. Valerian Mwenda. I am a medical epidemiologist. I work with the National Cancer Control Program, a division under the Ministry of Health, Kenya. And my major role there is I'm the lead cancer monitoring, evaluation, and research. And specifically, at the moment, I'm leading 3 key projects. One of them is creation of an electronic medical record system for oncology for the country. The second is rollout of human papillomavirus-based cervical cancer screening in the country. And the third, which actually has something to do with COVID-19, is creation of an electronic platform for healthcare workers training on cancer in the country. So thank you very much for having me, and I look forward to this discussion. Thank you.
Thank you. Adesola, please.
Yeah, thank you, Hadi. Thanks, everyone. Many thanks to for our sponsor for bringing us all together to be part of this health summit today. My name is Adesola Ogunleye. I work for Nigerian Center for Disease Control as an epidemiologist, part of the 2018-2019 cohort of the fellowship. I work in the disease surveillance and epidemiology department of my organization, where I support disease surveillance and outbreak response. During this COVID-19 pandemic, I was able to support in the response. I led the team with the Federal Capital Territory in my country, and we're able to, at the beginning of the pandemic COVID-19 response. But currently, I'm calling in from the UK. Currently pursuing my PhD at the University College London. In epidemiology. So nice to be here.
Thank you, Adesola. Let's go to Viviane next, please.
Ade?
Oh, hello.
Sorry, sorry, before we move on, was I the only one that was getting Adesola going in and out every now and again. Was the sound okay for everyone? Was it just me?
It was going in and out.
Yeah, I'm not sure why that's happening. Adesola.
Not sure either. I think my network is good. Let's hope it improves.
Okay, all right.
Fingers crossed, but we'll let you know if we have any audio problems again, Adesola, but hopefully we hear you clearly. Viviane next, please, and then Abdulaziz after.
Hello, good afternoon. My name is Viviane Hekweazu. I am the Managing Director of Health. I'm the Managing Director of Nigeria Health Watch, which is a health communications and advocacy organization based in Abuja, Nigeria. Our work involves mainly advocacy for health issues in Nigeria, raising awareness, holding duty bearers and government accountable to deliver on the health promise to Nigerians. And it's a real pleasure to be here this afternoon with all of you.
Thank you, Viviane. Abdulaziz?
It's really great to be here, and thank you very much for the organizers for bringing us together. I'm Mohammed Abdulaziz. I work with Africa CDC, that's Africa Center for Disease Control and Prevention. I head the Division of Disease Control and Prevention, and our main task is we have 3 units under that division. That's the units of NCDs and mental health, where we're devising a control program, working with partners and with member states. We're devising strategic priorities of implementation for Africa CDC in the area of NCDs and mental health control and prevention. We also have the division of endemic and neglected tropical diseases, and units and units of community health service, where we're all all brand new units in a brand new division of the Africa Center for Disease Control. And we hope, in addition, is doing in the areas of pandemic preparedness, we will be able to now start looking at really the real causes of mortality and morbidity for our people on the continent. So I'm really, really happy to be here. Thank you. Over to you, Ade.
Thank you. Let's go to Brian, and then just a heads up to Amma. We'll come to you after Brian for introduction, just a brief outline of yourself. Brian next.
Thank you. Hi, everyone. So my name is Brian Bngwatu. I'm based in Kampala, Uganda. I am a senior clinical advisor within our infectious and non-communicable diseases cluster at the Clinton Health Access Initiative. I am an ID specialist by training, and my role in the current COVID-19 response in Uganda sees me as a member of our clinical sub-pillar as well. My pleasure meeting all of you, and chat more soon, hopefully. Over.
Thank you. Amma, are you ready to say hello?
Hi, good afternoon, everyone.
Good afternoon. We can see
you
and
all
hear you
as
very
well. Good to see you all as well, and it's such a great honor to be part of this panel.
Yeah, thank you, Amma, and glad you are here. Could you just give a quick introduction to your to the attendees and to the other panelists?
Okay, so I'm Amma Feni. I'm a health economist and also a senior research fellow at the University of Ghana, here in Ghana, Accra, the capital. I have worked on different health projects, evaluation and monitoring, and currently I'm doing a lot of work on the economics of adolescent healthcare, reproductive interventions. So that's just a bit of my background.
Thank you. Well, Belinda, I hope you'll agree with me that it's such an illustrious panel we have here. It's a privilege to be here at the World Health Summit and to be discussing new paradigms for Africa. I think it's worth saying that there's a great regional split. Obviously, it's great to have great gender split as well, but also topic coverage, many different areas of healthcare that we have on display. Wouldn't you agree, Belinda?
Yeah, absolutely. I feel like we're in the presence of greatness. It's great to know that the continent is in your hands, our future. You're helping to make our future safe. So we are really looking forward to the next hour and a bit with all of you so that you can share your experiences, the work that you're doing in the various different disease areas and the different regions. And yes, I'm always for equality when it comes to gender. So it's good to see that we have equality on this panel as well.
Awesome, thank you, Belinda. And Belinda will guide us through some of these questions after me. We'll take it in turns to ask questions. I will engage our first fellow. And I think it's just worth saying as well, a little bit of a disclaimer that whilst we're all here from great organizations, ministries of health and universities, we're not necessarily speaking in those official capacities. So please don't take anything from here as new press release statements or anything like that. Obviously, we're individuals with personal views, and we're really glad to be hearing that. Just also a word for engagement from the attendees. There is the question and answer function. If you want to put a question to the fellows, if we have time, please just put it in the question and answer, and Belinda and I will pick up and ask. So Brian, over to you first. How are you?
I am good, given the circumstances, not complaining.
Of course, yes. Challenging circumstances. When we think about the overall headline topic for this conversation, will COVID-19 dictate a new paradigm for healthcare in Africa? Do you think that's an easy answer, or what's your view when you think of that question?
Oh, well, thanks, Adi. Again, first and foremost, as the only Ugandan on the panel, I think welcome to everyone to the Pearl of Africa. I know it's an welcome. These are special times indeed. I think my broad answer, and a cautious one at that, is yes, I believe so. So one, I'm mindful of the fact that COVID has not spared any continent, and certainly Africa, we know the havoc in millions of cases, up to about 5 million, mortality up to 140,000 cases. And there's been a clear emergence of a downside in all this in terms of clarity in long-feared north-south inequities in all things global health, disproportionate distribution of commodities, and we've generally lagged behind as a continent in about every metric during the response. On the other hand, and I guess this is where my confident yes comes from, I'm glad we have a few people from Ghana on the call. I think it's Kwame Nkrumah who years ago first spoke of the need to find African solutions to our problems. And he did emphasize that would emerge from unity, that our struggles, if anything, are pretty common. So from a general perspective, I think the pandemic has brought an inadvertent reminder to the value of what has kept us going as communities for years. I think the word is Ubuntu, if I'm not mistaken. So to your question, the power of the collective in addressing these well-documented, long-running challenges to health access is incredible. And I want to think through two levels. First, at country level, in terms of paradigms, COVID-19 has, in a very bizarre way, shown a sustained, keyword for me here is sustained, a sustained spotlight on health, on our fractured health systems, as is the case in many a country in the continent. And countries have had to rethink and reshape their framework on all things health. I woke up to beautiful news in Uganda today of a commitment by government to allocate up to $150 million towards health research and innovation in the coming years. And that's something that was unheard of pre-COVID. So I can imagine what will emerge in terms of training of much needed expertise in the health space. So fingers crossed that comes true. And at continental level, I think very early on in this crisis, we saw leadership from the African Union and the Africa CDC, who have been front and center in fostering partnership and synergies to coordinate the response. The Africa COVID-19 Response Fund for me was an example of how we are at the start or strengthening of a new paradigm. So on this front, I believe that on the short to long term, we will see an emergence from all these lessons learned from the power of what has been a rewarding model, that is that collaborative that I spoke about earlier. And hopefully that we'll see that collaborative leverage across disease areas, be it cancer therapy, be it access to diagnostics and that kind of thing. And again, to end and sum it up, we have clearly learned from, we've seen the old adage of, if you want to go fast, we'll go alone. If you want to go far, move in tandem, go together. And I think that's a new paradigm that we should see emerge within Africa post COVID-19.
Yeah, okay. I suppose one of my reactions there is thinking about how sustainable, how long will those shifts stay, and I want to take that question into a particular niche that you're involved in, or a particular topic that you're involved in. So thinking about the fight against antimicrobial resistance, do you see, for example, a correlation between the improved hygiene practices, or at least the more communication about these improved hygiene practices in the fight against AMR? Do you think there will be benefits, secondary benefits to other areas? So, so will AMR benefit from improved hygiene, or do you think we're making assumptions and human behavior will move us back towards the previous mean, the previous average?
Again, thanks, Ade. Great question, and one that has been dancing in my mind for the last couple of months as someone who's deep in all things AMR. I have to say, before anything, that one of the pluses of the pandemic is it's been a joy to see kids led in song on all things hand washing in some countries, and indeed to see a couple of adults step up with regards to hygiene and hygiene practices. So yes, there's every suggestion that we have seen an improvement in hygiene practices first and foremost. And I can't not start without reminding us that the estimates pre-pandemic are that we will see an emergence and spread of AMR over the years to come, that we will see up to 700,000 people dead, and a number that is projected to climb towards the greater end of 2050. And for us in the poorer corner of the globe, where we have inaccessibility to healthcare, we have seen other factors continue to play a part with regards to AMR beyond hygiene, such as a broad availability and irrational use of over-the-counter antibiotics. So I'm also reminded that in COVID-19 case management, we've seen broad use of antibiotics, which are not necessarily directly linked to hygiene practices. It's interesting, a meta-analysis that I read up a couple of days ago spoke of how we've seen prescription rates of up to 72% amongst COVID-19 patients, yet only about 8% of that number had any bacterial or antifungal co-infection. So to the question, I think one of my concerns today is that there's a lack of sufficient data, and it is uncertain how the pandemic will affect AMR. And that largely addresses the second part of your question. COVID-19 as well has come with a disruption of research, and perhaps importantly as well, it has also compromised sustained implementation of investments made towards AMR in terms of training, in terms of surveillance, and about every other pillar that is pivotal for AMR. And indeed, the fight against AMR is multifaceted, and hygiene practices are it falls in one of about 5 or so buckets that are crucial for AMR control. We still need to see investments towards surveillance, towards stewardship, towards R&D of new antibiotics, training and the like, towards antibiotic awareness, and so on and so forth. So to your question, lastly, I think that we have anecdotal evidence that extensive implementation of hand hygiene, amongst other interventions, may contribute to decreasing AMR. But again, I am mindful that hygiene practices do not fall in silo. It has to be in tandem with a number of other interventions. But last but not least, behavior change interventions, I think, are going to be crucial for our corner of the world, where we've seen them bring reward in disease. And if you ask me in a year's time, the heart of my research today, if anything, is behavior change interventions in the context of COVID-19 and AMR. So hopefully I'll be able to give you a more solid answer then.
Thank you. Before we move on to our next fellow, my last question is just testing what you've said a little bit. So if I heard you correctly, there was something you said about not enough data to understand where some of the trends may move towards. So just using that to test what you said earlier about, well, you spoke quite positively about the new paradigm. If there is a lack of data and it's not very clear, what gives you the confidence to say that this will be a new paradigm, this will be a shift for the continent? Is it hope?
Well, hope is that which we all hold on to, I hope, if anything. So yeah, I think there's hope. Again, the pandemic has helped us appreciate to great depth the value of data, the value of training, the value of surveillance, and how we are able to leverage about every institution out there to make the most of numbers, to know what infection rates are, to know what vaccination uptake is, and so on and so forth. And I think that the excitement for me, if anything, is one of the future possibilities is we're going to see an emergence of leadership, of people keen to take on research. When we talk Africa, we know Africa is a young population. The country that I am in, Uganda, and Niger are two of the youngest populations in the world by proportion of their populations younger than the age of 30. So my hope is that the young people out there have seen how the inequities and struggles of our health system have brought us to a point of struggle. And I am optimistic that we will see more healthcare workers emerge from that population of young individuals out there. For there's a ton of work to be done in the long road ahead that is our recovery as a globe, but certainly as a continent in the health space in particular. And again, just one more thing, if I may add, is this collective that I spoke to earlier. I can't wait to see us make the most of institutions that have not been given their due attention, like the Africa CDC, and what pivotal role they could help down the line in driving local African-driven innovation and research. And hopefully we'll see more data emerge from work down the line. And positive for sure is my ultimate response, Ade.
Thank you, Brian. We may come back to you, and I've seen some questions in the question and answer chat, so please do keep them coming. We're going to move on to Amma next, if we may. Thank you, Brian. Amma, Brian spoke of some opportunities. He also spoke of a young population, and I think inherent in that is the challenge within leaders to mobilize and galvanize and create opportunities for citizens to then engage meaningfully in work, etc., etc. That leads to our first question to you, which is, what role do you think you've seen leadership play in responding to the pandemic, regionally, locally? Brian also spoke about investment in Africa CDC, a strong convening arm in this space. Just interested to hear some of your thoughts about leadership in what we've seen over the last year or so. You're on mute, I think. There always has to be one.
Yes, okay. Thank you so much for this question. And any question about leadership, especially in a critical time that we have, like COVID has presented, has been seen in how different countries have reacted to the pandemic. So we've seen good leadership and we've seen very bad leadership as well. And we've seen outcomes from bad leadership and good leadership. One of the things I need to point out, and one of the things that I have seen as being successful in terms of great leadership during this pandemic crisis is the fact that good leaders have been able to galvanize teams to work together one good outcome. So that ability to work together with different experts and expertise from different sectors, we have seen that play out time and time again. And so issues to do with communication, for example, have been very critical, especially in a society where everybody is anxious and people are not sure about information that is coming out. So we've seen communication as being very critical to the success of good leaders, good leadership techniques. We've also seen sticking to core values. So COVID-19 has presented an opportunity for leaders to re-emphasize their core values. What really is critical to you as an organization or a country? What are your core values? A lot of countries have been tested, and we've seen it play out. I am an advocate for UHC agenda across different countries. I know we may come back and talk about UHC, but really one of the core things that UHC pushed was leave no one behind. And we've seen this play out in the leadership roles within the COVID-19 response. Good leaders have galvanized for policies that leave no one behind. And we've seen also leaders that have been very critical in the way they make decisions, because we expect leaders to make very quick decisions. Every day is evolving, new evidence is coming out. What do you do as a leader? So I have sort of carved a little acronym for good leadership, so it's C for communication, C for sticking to your core values, D for making good decisions, and then the final thing is actually planning ahead. So good leaders have been able to plan ahead in the long term, looking at the long-term strategies. So in my view, as Brian mentioned, Africa CDC has shown a lot of leadership, good leadership, when it comes to COVID response. We've seen them play out in all these different variables. They have communicated, they have shown that they are sticking to their core values, they have made critical decisions, and they've really taken on board all the different evidence that has come up. So I think we have seen the different aspects of leadership, and going forward, we have a lot to learn from what the COVID response has been across different nations.
Yeah, and if any of our attendees or even other fellows have aspirational leadership dreams, I hope you'll be taking notes, because that's definitely something that will help you get to that other level, the core values, and being able to transmit them to people. And so that's a useful descriptor, I think, to summarize how the response has been managed and how good leadership, particularly those that transmit values well, has helped manage the response to date. If we look beyond now, and particularly focusing on UHC, universal healthcare, as you've said, what do you think are the things leaders need to be saying, the persuasive arguments to build on that and to make sure that you can get more UHC benefits for populations?
Okay, thank you very much. The UHC agenda is very politicized. I've always said you cannot take politics out of the UHC agenda. But again, we need the push of our government's political commitment to be able to reform our health systems and make them more resilient. And so we have seen this translate in the different responses that have come through COVID. The core idea of not separating risk pools, for example, when it comes to health financing, has been very critical. And we know that one of the many foundations of UHC is to ensure that all people have access to good quality care without getting impoverished in the process. And COVID had no respect of class of people. And we have seen this play out, especially during the very critical times when government leaders, several of them got ill and couldn't fly out of their countries. We saw that play out. So the need for more resilient health systems was very evident. And we cannot, this is a time to actually hold on to the UHC reforms. As a continent, as countries, we need to start going back to build our primary healthcare systems, for example, to build leadership qualities within our health workforce, and try to be more holistic and cohesive in our reforms. So, I mean, I think COVID presents even a better opportunity for us to embrace UHC reforms at this particular time. Thanks.
Yeah, I certainly hope so. And there's a tricky question I'm going to throw to you, which is now that we had that question of looking forward, I want us to look forward, well, be forward and look back. So there's this concept called a post-mortem. If we can have a bit of a pre-mortem. So this is now thinking, if something went wrong, why would it have gone wrong? So the question now, let's assume we're in 10 years time and we haven't capitalized on UHC reforms. Why do you think that would have been? What do you think would have been the stumbling block that means we wouldn't have had the progress that we would have liked?
First of all, I would flag politics. If we do go down the political route, which we've seen play out in several countries, my country being one of them, the fact that every sphere of our lives are governed by what we do within our political arena. We have to step back and find a way of leaving the politics out of our health systems and whatever other health systems we have. If we can try to look at the health sector as a productive sector, devoid of politics, then we can move the system forward and get commitment from different aspects of different facets of the societies. One of the things I also reflect on as I have seen the pandemic play out is the fragmentation of different ideologies coming into to confuse people and to break societies apart on different lines, not just party lines, but different several, age where we have older people being given different treatment from younger people. So there's a lot of polarization going on. And if we don't move beyond that, we will see a future where we cannot move towards these UHC reforms. So we need to be very intentional about leaving the politics out of our health systems if we can. Thanks.
Yeah, and a last tricky question from me, if I may. Politics, some people can say, is a bit of a dirty game, and there are many different tricks that, as you said, misinformation to play people off against each other. Would you suggest or advocate healthcare leaders like yourselves perhaps playing some of those dirty tricks to stay ahead of that politicization and to try and remove health from that space, or what do you think?
No, so Adi, that's a very tricky question, but I'll try and be very rational in the way I answer it. So my thinking is that we can never really remove health from politics. What we are saying is, let's put the human life at the core of every decision of any party, for example. So every life is important. UHC says, do not leave anyone behind. Don't separate and create risk pools that leave people frustrated. And if we can all hold on to this message, then it doesn't matter which party we belong to or which groups we belong to, we have this core value to look at every individual life as very important and work on building our health systems to support human life. That really is a summary of what I think will carry us forward. The politics will not go out of our business. It's here to stay, really, especially in systems like ours. But we really need to move forward and have our core values right. Thanks.
Thank you, Emma. Trust a leading health economist to give a very rational answer to a very tricky question. Thank you, Emma. Appreciate your time. I have one more fellow to interrogate before I then hand over to my co-host, Belinda. Mohammed Abdulaziz. The same question that's kind of our headline for the session. And I think one of our attendees, Rob, has asked, do you see the COVID-19 crisis catalyzing UHC reforms, creating a new healthcare paradigm in Africa? Are you hopeful or pragmatic, or where do you stand?
Thank you so much, Ade. This is really a very, very welcome question, and I'm happy we have young people here to listen to us as we debate this very important aspect of public health in Africa. So what the COVID-19 pandemic has clearly shown is that we need to move from the old order of Africa getting help from more developed countries to an Africa that has a fairly well-developed health system and able to respond to its problem on its own. And I will tell you why this is important. As you may know, infectious diseases remain a great threat to Africa's aspiration to achieve the Agenda 2063, which is the Africa we want, the health component. If you look at the Africa's underlying burden of endemic diseases is the largest in the world. Infectious diseases play a particularly severe role on the continent, and in particular, every year, they account for over 227 million years of health life lost and produce an annual productivity loss of over 800 billion. So the SARS-CoV-2 pandemic has clearly shown how infectious diseases are a serious threat to health, global economy, and security. Economically, the SARS-CoV-2 pandemic is forecast to cause a 5.2 contraction in global domestic product and the 2.8 contraction in sub-Saharan Africa. Nigeria actually went into a recession not so long ago because of the pandemic. In the midst of this, Africa has learned how fragile international cooperation can be when there is collective response. For instance, there was a breakdown in the international logistic chain for the drugs, for laboratory consumables, for IPC material, and now we are seeing that Africa is the last in the supply chain for vaccines, and so all of these have really shown that we need a new public health order. This is how we put it in Africa CDC, because we need to really have a paradigm shift and let the political leaders in Africa know that this is real if Africa is ever going to have health security. So we propose in Africa CDC, this new public health order must stand on 4 pillars. The first one is a strengthened public health institution. National public health institution across Africa should be strengthened. Local manufacturing of vaccines, therapeutics, and diagnostics must be strengthened. Public health workforce must be strengthened. And finally, a respectful local and international partnership between Africa and its development partners. Now, looking at MPHIs, for instance. When we say MPHI, we're talking about National Public Health Institution. And we have some very good examples of this on the continent. Now, we have the Nigerian CDC, Nigerian Center for Disease Control. We have the Liberian Public Health Institute. We have the Ethiopian Public Health Institute and the Zambian National Public Health Institute. So what does that do for Africa? First, it brings all the area of response that is needed for pandemic preparedness under one roof. Lab, emergency operations center, surveillance, and all have you, with a strong leadership. And it can help with coordination and ensure that, like Brian said earlier, the use of public health research to positively have an influence on policy. So that's the first one. The second area where we really need to lay a lot of emphasis is the local production of health consumables on the continent. It is really not right that Africa produces only 1% of its vaccines and lack the capacity to scale up production. In this regard, local production of medicine is equally critical because right now, Africa imports 70% of its needs. If you compare that with India imports just 20% and China imports just 5%. There is no way we can have health security if we are doing that. So this is one area that we need to have this paradigm shift. In the area of of a public health workforce, a very important aspect where we need to be able to sit down and know where our priorities are in the development of workforce health, the public health workforce on the continent, so that it's really easier, cheaper for Africa to have this workforce and be able to respond to pandemics than waiting for experts coming from more developed countries. And mind you, it's now shown that we cannot continue to do that, because when very serious situations like pandemics come, we don't have anywhere to go to. Finally, let me end with this. We also need to ensure in the new paradigm shift for health that we create mechanisms to maintain humanitarian corridors to be open during health emergencies and crises. Countries will have run out of supply if not for Africa Union mechanisms that had to ensure that some humanitarian corridors were open after we locked down to ensure supply of diagnostics, medicines, and even IPC materials. Thank you, Ade. Let me hand over back to you.
Thank you, Mohammed Abdulaziz. This may be an opportune time to bring in a question from one of our guests, Ruth, because I note a lot of the things that you say are needed, the new public and the 4 different pillars which come together under the new public health order. I suppose where the question that I bring in that also aligns with what Ruth is asking is probably noting what you haven't mentioned. So, for example, we've seen some of the secondary effects of mental health. We see some of the effects or the opportunities in palliative care, in the non-communicable diseases. Is it that there's no space on the agenda for those things, or maybe there are things that we'll have to look to address in 5 years' time after we get some other priorities done? What's your view on some of those things which we've seen really necessary as a result of COVID-19?
Really, thank you, Ade. Though I spoke in the context of COVID-19, but if you look at the agenda for the new public health order, the new paradigm shift, it addresses NCDs, mental health. We've seen how mental health had suffered during this pandemic. The services that were completely down, mental health accounted for part of them. If you go to the PEC survey, logistic chain was broken, and we know a lot of mental health conditions require drugs for extended period of time, and the mitigation for this pandemic also had severe effect on the mental health, especially in Africa, where men were used to going out and suddenly they were locked down, and then we begin to see issues of aggression and violence against women and other vulnerable populations like children. I mean, these were very, very big issues, almost in some series, 3 to 4 times increase in rape and sexual abuse and all sorts of abuse happening on the continent. So mental health became a big, big issue. So if you look at when we talk about ensuring local manufacturing of drugs, it also extends to drugs that will be used for non-communicable diseases and mental health. You're having a strong national public health institution like Nigerian CDC will entails that NCDC should have under its roof an NCDs and mental health department that will be looking at, in addition to universal health coverage as mentioned by Amma, will also ensure that all of these services are provided at scale in the community. So the new public health order, or the new paradigm shift, as you call it, is not meant to only look at infectious diseases, but we are just using COVID-19 as an example, because even the workforce development, we want a situation in which we can look at the critical needs in mental health and non-communicable diseases and how to address it. And in this regard, we've been looking at how to use community health workers more to scale up these processes in the community in such a way that we can have quality services at the lowest level of our health system, while strengthening the mid-cadre level like general hospitals to be able to attend to some of these diseases. The new public health order will be available to strengthen health, not just in the infectious disease, but also in the non-communicable diseases and other often neglected area of health system. Thank you, Ade.
Mohammed Abdulaziz, my last question before I hand over to Belinda, and it's going to be a tricky testing one, is surely if we're to agree with what Amma was saying about, you know, politics and health being intertwined, healthcare leaders can't necessarily go to their finance purse people, the people that hold the money, and say the new public health order has to have it all. Surely we have to say to people like Ruth, who have argued for palliative care, or people who say mental health, actually, we can't have it all. We have to have these particular things. You know, public health order, the new public health order can't have everything, surely.
No, so that's where prioritization takes place. But you know, when we prioritize, we also have to be guided by evidence, and some of the evidence that we need to use. You know, you are not a public health institution if you're not guided by data and evidence. And I tell people the evidence that works, that we must be keeping an eye on, are the where is the burden of diseases coming from on the continent? What is responsible for mortality, for morbidity? We in Africa know that what our people are dying from, and we also know that we need to be guided by evidence from our surveillance, evidence from that they collect ongoing collection of data from the field, to know exactly where our priorities should be. So this prioritization should be done by the national public health institutions. And the only way we can get it right is if these decisions are taken from using data coming from the continent, not data or being brought from outside the continent, but data coming from the continent that indicates where our priorities should be. And one of the things the new public health order, the new paradigm shift should be is help countries to develop that strong public health institution that can be able to look at the data critically and make decisions and policy from those data. Thank you.
So not to take things off the table, but to make sure everything that we're arguing for has an evidence base behind it, so that we can make persuasive arguments.
Absolutely. Thank you. Yeah.
Thank you. That's the first three of our panelists interviewed. I wouldn't say interrogated. Over to you, Belinda. Thank you.
Thank you so much, Ade. Yes, and such insightful answers coming from the team so far. I like what I'm hearing about, that it's science that's going to make us help us to make decisions going forward. You know, it's collaboration that's going to help us to work together and prioritize. On my side, I'm going to go to Dr. Adesola first. She's with the Nigeria CDC, so getting a perspective out of the west of the continent. What is your take, Adesola? Will COVID-19 dictate a new health paradigm for our continent?
Thank you so much, Belinda. So, my colleagues already mentioned this, but we can't overemphasize that the ongoing pandemic is still ongoing. It will determine a new paradigm for Africa. Not only Africa, I'm sure we all know that globally, there's going to be new paradigm, the way we work, the way we carry out so many activities. The way our health sector is structured will be affected by the pandemic. Now, we know that, particularly in Africa, before now, it's almost as if we want to say health of Africans is not our priority, because we seem to be so much dependent on what comes from outside Africa, both in research. Abdulaziz just mentioned, sometimes when we have to make a decision, we have to say, oh, there's paucity of data in Africa. So we have to be using data from outside Africa to make decisions on what happens on our continent. The vaccines we take, we have to depend. Gavi, now we're talking about COVAX. It is a time for us to have to sit up and know that now the priority, the health of Africans should be the priority of Africans. It should be our own priority. With the ongoing pandemic, like mentioned, we can't expect, technical support from countries that are also battling to deal with their own pandemic in their own country. So it is time for Africa to take health of our people as a priority. And in that sense, that means we need to begin to plan and ensure we have adequate resource allocation to health of our people. We don't need to remain dependent, carrying begging bowls, looking for resource to fund vaccination, to set up, research. Then our health, our universities, our health institutions needs to take their place, when it comes to research. Where are our universities in Africa? Where are they? What research is coming regarding COVID-19? What has been done? It's time for us to be able to, sit back and know that now we need to move. It's a time for, we know that for Africa, perhaps relatively we've had the incidence, the mortality compared to other parts, other continents might have been low. But we shouldn't see that, we shouldn't clap our hands. Perhaps we should see that as an opportunity for us to begin to push and ensure we get our continent, our health care system into the standard that will be acceptable to give what the health that our people demand. So it's a time for us to be able to, we need to move. We can't continue to be dependent. We need to work. Our health institution, research institution needs to arise and begin to work so that we can generate data for use for our people. Thank you.
Yeah, I totally agree with you, Adesola, because it was certainly a wake-up call for the continent that our health is we should own our health, that it should be a priority for us. The dependence on others need to be reevaluated. And what you're pointing out is that a lot of the resources are here already. We just need to develop those capabilities. Some of the universities are doing some of the work. How can we work together, collaborate, and accelerate just our ability to use data, to use research, and make decisions and come up with plans and actions for Africa that is suitable for Africans. That being said, we know that leadership still plays a huge role. So what do you think leadership has been the quality of leadership, regionally, locally, nationally? What's your take on it? What have you seen?
Yes, so in response to the COVID-19 pandemic, we have leadership has played a critical role. We have the political leadership on one hand, and then we have the technical leadership on the other hand. And as been said earlier, two of them need to work together to ensure we have a good response. Now, so politically, we know that we have countries that have responded well in terms of being able to take decision in good time, because For instance, the head of Nigerian Center for Disease Control will not get up and say, oh, there's pandemic going on. We need to move to lock down, shut our borders and all that. There's a need for our technical leaders, based on evidence available, to work with our political leaders to ensure that, one, that the right decisions are made based on available scientific evidence. You know, there's the need for a political leader to support them in taking the right decision at the right time. So political leadership has been very, in some countries, good, which has been helpful. We've had places, national or even subnational, where leaders are in denial, and because of that, deny their people, of being able to, or the response that was required at the right time. So political leadership has been very helpful. Then the technical aspect, before the pandemic, good enough on the African continent, we saw this call for establishment of public health institutes. And some countries do have, some don't. And we saw African CDC taking the leadership in, ensuring, supporting countries to establish this. And I think that has played a major role in perhaps in the little wins that we've got with this with the response to this pandemic, because the Public Health Institute being able to take responsibility, coordinate the response, and with the support of political leaders, made a lot of difference. So leadership is very critical, and like we said, being able to merge the political aspect with the technical aspect is very critical. But one very important point I also want to make is, when we have the ability of our leaders, especially our technical leaders, the heads of our institute, for instance, when we mention the NCDC, for instance, the African CDC at the regional level, permit me, I will mention NCDC because that is where I work at, that's my country. But we could use this as an example, having leaders who are technically sound and also having the managerial skill to be able to manage this pandemic has also been is very important, because if you have the technical skill and you're unable, to take the lead in being able to get things done, you have to relate with political leaders and all that to ensure the needed funding, the human resources, all those things are very, very important for us to be able to get good results in our response to this pandemic. So we need good leadership, technical, and also the managerial skills of our technical leaders are very critical. And I think that's where we've had our wins. Those are very important skills that came to play.
Yeah, certainly we see the different kind of leadership, the different skills that needs to come into play, and then collaborating together for us to beat the pandemic. And where that has happened well, we certainly see the outcomes of that. If we move on just to the next question, do you think that the pandemic is an opportunity to tell the public the story of One Health and to get the idea more into the public consciousness? And what do you think leaders can do to do that better?
Thank you. So One Health is very critical. One of the recurring questions around this pandemic has to do with the source. How did it come about this? And from the available evidence as at now, we still believe this is a zoonotic infection. The WHO team investigating the origin of this virus, the report has shown that this is a zoonotic infection. It's a zoonotic infection caused by spillover from animals. even though there are people, there are other hypotheses around this, but we all agree we're dealing with a zoonotic infection, you know, and then followed up with a lot of mutation in the virus and all that. So not at any point in time do we have that opportunity to drive home the importance of One Health. Before this pandemic began, I know there have been a lot emphasis, a lot of meetings, conferences, workshops around One Health, trying to ensure that we develop, you know, and carry out our disease control efforts using the One Health approach. I believe we made some progress, especially in terms of awareness. People are more awareness. Actually, before this pandemic, many more people got to be aware of One Health, the approach, and you know. However, we know that there's so much talk about One Health and implementation, and what we need now is how do we implement One Health. There's COVID-19 pandemic has brought a lot of interconnectedness, you know, in our approach to response. We saw that apart from the origin, we saw that the effects, the impacts of the pandemic on every sector, not just the animal, the environment, economic and all that. So, and then the response also has also been multi-sectoral. We saw on the you know, sitting down people from the environment sector, finance, everybody sitting together, and that is what One Health is all about. But we don't stop at sitting down. We need what we need to push forward further is commitment. There's a lot of talk about, oh, One Health, we need to work with the animal sector, with the environment sector and all that. But the important thing is us being able to ensure that we're not only saying this, but committing to it. Before now, having done some research work on One Health, when we discuss, you know, some perspective seems to be like, okay, when we talked about One Health, we are discussing about coming together, resource sharing, then we'll go and do the work. No, but we know One Health has to do with every sector, having that commitment to health. So if I work in the environment sector, or I work wherever I work, whatever I do, having that mind, that's the impact of what I do on health is very important. And I think this pandemic is a very, very important another way for us to drive that home. And what do we have to do? For instance, it's not only COVID-19. There's cholera, Lassa fever. All these are very diseases, you know, that are with us for decades. For instance, cholera. There are ongoing cholera outbreaks in different parts of Africa as we speak. How do we manage this? And when this is ongoing, what do we do? Perhaps you call on the Minister for Health to explain, and what are you going to do? But we know that the Minister of Health is only handling, you know, managing what has failed in the environment or any sector that is supposed to provide safe water for the people. So we need to get to the point in which we need to hold every sector accountable for the health of the people, and not just the Ministry of Health. We need the people working in the environment sector to take that, to be committed to health as much as people in the animal sector. You shouldn't just be committed to the health of the animals you care for. You need also to have that approach. As I'm caring for my animals, you know, we need also to ensure that the impact on human is taken care of, you know, while we plan, while we'll execute whatever we have to do in a various sector. What are those areas that we need to do? Before now, we talked data, being able to have data, surveillance. So we do a lot of surveillance in human. We have our protocol, we have that, but what about animal surveillance? Environmental surveillance. These are areas that we need to develop in Africa. We should be able to monitor what happens in our environment, what happens within the animal, not only domestic animals or our pet now, what's happening in the wild. You know, in recent time, we began to work at the NCDC, we had collaboration with our colleagues in the animal sector, bringing in people working with with wild animals and all that. So we need a point in which data should be available. There should be surveillance, you know, monitoring as we monitor the health, diseases in humans. This also should be done in the environment. What are those things that are happening? You know, so we talked about research. You know, of recent, we also began to do some work, collaboration in research with our colleagues, both in the environment and the animal health sector. We need to work together as one, you know, having the same focus, which is health. And we know, as we do for human also, the health of the environment, the health of the animals are also taken care of at the end of the day. So data sharing, there's a need for us to have that system in place in which we can work together and share data. For instance, rabies is something that is still with us, and unfortunately we have people dying of rabies. These are vaccine preventable diseases. If dogs, and other animals are vaccinated, we prevent this in humans. So if we have data, if we have good data for us to understand what is happening in the animals, if this data is available, then it can also help in the human sector in planning. Do we need to stop the anti-rabies, you know? So is it very important for us? Intersectoral data sharing is very, very important. We talked about sharing, vaccine and drug development. These are all areas in which we need to look. Lassa fever has been with us for decades, you know, and where are we with it? Vaccination. If we can't eliminate, there's a need for us to be able to work together, you know, multi-sectoral collaboration to be able to tackle this, a lot of diseases. Bushmeat, we talked about how do we handle the markets, live bird market, for instance. We need that collaboration. For people, for instance, the women in the live bird market need to understand the implication of this on themselves and on the environment. So there's a need for, we still have a lot to do in working together and collaborating to ensure good health for our people. Then, of course, maybe the last point will be funding, because usually when we discuss with our colleagues, especially in the other sector, the point will be, oh, we are not funded. The animal health sectors, oh, we have funded basically for food production, not to prevent disease. So we are now at a point in which the animal health sector needs to know that they are working beyond food production. You know, safety of the consumers is very important. COVID-19, for instance, we know have been found that it can be transmitted, you know, through food chain. Frozen food can still carry this virus. So we need a lot of work to do together to protect health. Thank you.
Thank you, Adesola. Yeah, there's a lot of areas to consider, and you pointing out how everything is just connected, how we need data and research to make sure that, you know, we're making the right decisions, and you know, just making sure that we're implementing with commitment, you know, and having the correct funding in place. So lots to think about. You've certainly given me lots to think about, and I think it's great that we use the pandemic as an opportunity to just see how we're approaching things. I heard Brian say earlier, referring to Ubuntu, and you were just going beyond that. It's beyond humanity. It's also about the environment and how everything is connected. So thank you for your insights. I'm going to move over to Viviane now. Viviane, welcome. Also coming to us from Nigeria. You've heard what the other panelists have said about, just the big question that we're asking today, which is it going to dictate a new health paradigm in Africa? So what is your thoughts? What are your thoughts on that?
Yes, hello everybody. I think the previous panelists have actually covered quite a lot of the issues in terms of looking at what we'll say is a new paradigm for Africa. I think also, it requires us to also understand what we see as the paradigm and what we understand to be the old paradigm of health in Africa before the pandemic. Our dear continent, Africa, we have more than 1 billion people. We still have the largest percentage of the global burden of communicable diseases, malaria, TB, HIV, and rising NCDs that Brian mentioned. And we are not even close to addressing a lot of these, and they are a growing threat. And historically up to now, African countries, we've not dedicated sufficient share of our national budgets on health. I think it's important to mention that. We must all remember that almost 20 years ago, our governments made a pledge to allocate at least 15% of our national budget on health. And this infamous budget declaration that we're all familiar with has barely been implemented. And so far, the only countries we can say that have even come close to that 15% is probably maybe Rwanda, South Africa. In Nigeria, we're barely scratching even up to 6%. So, this old paradigm of health not being prioritized, we also need to remember that. And also funding for health, we've alluded to that a bit. Most African countries, a lot of healthcare is still delivered through the private sector and out of pocket. Nigeria, where I live, over 77% of healthcare expenditure is out of pocket, and this has left many families, really financially crippled and often not able to take care of their healthcare needs in the formal sector, which, sometimes resorts to people going, to medicine vendors and, your local traditional medicine stores to seek healthcare because of the significant cost, which, leads us to the whole discussion about UHC. And then came COVID-19. And that really, I think, is now where we're talking about this new paradigm of how we look at health on the African continent. We all remember how there was speculation, or people were saying that the African continent would be devastated by COVID-19. We can't say we are completely out of the woods yet. The simple fact is that had we faced that large number of cases that many developed countries face, we had a chronic shortage of ventilators, intensive care beds, the necessary of even high-skilled personnel to deal with the pandemic, as we also, borders were closed and we all were left very vulnerable. And this new paradigm also means looking at when such things happen, how do countries cope? Developed countries, when they're shut down, they had the social safety nets to cope with their populations, to help their populations. Many countries witnessed the lockdown being a very difficult time for many families, as that social safety net did not exist, which puts the continent at a risk. So I think lessons have been learned and lessons are still being learned. Some of which include resource allocation to the health sector, which needs greater prioritization more than anything. Another is that as a continent, we need to be more self-reliant. I think Abdulaziz mentioned the fact that when we had when the lockdowns happened, suddenly there was a realization that you couldn't import basic medicines. I know Nigeria, that was one of the critical challenges that the country faced. And also our political leaders couldn't fly out, which meant they had to take a hard look at our domestic health sector. One of the leading government officials, I won't quote who, actually said that he didn't realize how bad the health sector was in Nigeria until the pandemic. And if we are talking about political leadership, for a senior leader to say that really shows the disconnect between the realities that ordinary Nigerians, ordinary Africans face, and our leadership. And so this new paradigm really requires, looking inwardly in terms of being self-reliant. We saw there was a scramble for therapeutics, diagnostics, and now vaccines. We have to be honest, the vaccine nationalism we're seeing is a real wake-up call. Our continent is able to produce less than 1% of our vaccine needs. I think it was Abdulaziz who mentioned that. So really, I think further to this new paradigm has to be looking at the collective effort of institutions like Africa CDC that really at the onset of the pandemic last year helped in securing testing kits when there was the global scramble. Again, talking about vaccines, the African Vaccine Acquisition Task Team and the African Export Import Bank pooling funds to purchase COVID vaccines, although we all know now that, even with money, the global supply is a challenge. And really, I think also, let's not forget that going forwards, leveraging on frameworks like the African Continental Free Trade Agreement that will enable sustainable development and for African countries to work more collectively together. I think it was Abdulaziz and also Adesola mentioned the importance of research. The current move for vaccine manufacturing in Africa is a good example of this need for a new paradigm where we don't want to be on the back foot again as a continent. We cannot afford it. Countries like India got a head start in vaccine manufacturing. And this was helped by, favorable government policies and an enabling environment that enabled an ecosystem to be built around vaccine manufacturing and also basic drug manufacturing. So I think, in summary, the new paradigm will now require African countries to collectively look internally at how we can drive our own needs in the health sector and not be caught again, I think, on the back foot as we saw with the COVID-19 pandemic.
Yeah, absolutely. The wake-up call for us and to take the ownership of our health and make it a priority and make sure that the requisite money is spent on it, because it impacts everything. It impacts our health, impacts everything. So you've listed so many of some of the things that we need to focus on. What do you think are the messages that we should be driving home right now and reinforcing now that everybody is just focused on healthcare? Everybody is talking about it. Our industry, I think we underestimated being in the healthcare industry and talking about these things on a daily basis. Certainly when it comes to my family, we've never discussed hospitals and the healthcare sector the way we do now. And now that everybody's focusing on this industry and on healthcare, what are the messages that we should be driving forward and reinforcing?
You know what, Belinda, I think, never before in our lifetime has health brought global economies to such a standstill. And I think the big difference with the COVID-19 pandemic is that it simultaneously hit all countries around the world. And as we watch the pandemic literally unfold in real time, economies were literally crippled as we saw them. And never before has this interrelatedness between health and the economy been driven home by the pandemic. The message I think that we really need to drive home now is that health really is everything. No matter how many bridges you build, no matter how many beautiful, shiny trade deals or whatever you may be able to do, nothing can be achieved if we do not have health. And really, I think this makes us perfectly placed to drive home the vulnerability we face. First of all, the spread of infectious diseases. We know clearly that, they do not respect borders. They don't need passports or visas. We're seeing variants spread like wildfire around the world. So health security has got to be top of the agenda. And, when we talk about security to our global leaders, I mean, we have the same situation now in Nigeria where a lot of the work, like, for instance, my organization, Nigeria Health Watch, does is advocating for more funding for epidemic preparedness. When we talk about security to our leaders, they often think of guns and tanks and soldiers, but none of those could have prepared us for the global, the COVID-19 pandemic. So I think health security has got to be top of the agenda now. Never before were people so focused on the importance of making sure that we had our hospitals, we had our healthcare workers, we had our medication, we had our vaccines, all of those things all come together in driving home the message. And I think we're focused a lot, I think today also on us who are kind of in this health bubble, or we understand all these challenges. But at the onset of the pandemic, ordinary Nigerians were not really aware of how dire the health sector was. And one of the things we realized is at the onset of the response, it was driven by science, understandably so. But that community engagement came much later on. And the realization that to get people to adhere to public health measures, to understand why they have to wash their hands, requires trust. And I think that trust was something that was underestimated, and understanding the importance of behavioral change, and not just the science of vaccines, but also the science in how people think and how they respond to messages. So I think if anything, I think all of these things, risk communications, the science, the research, these I think are important lessons that, if anything, the COVID-19 has really driven home. And I think are lessons learned for now and going forwards, because this is not the last pandemic we will experience, and hopefully nothing soon. We really want to get out of this one as soon as possible.
Absolutely. Yeah, everybody's paying attention now, and everybody's beginning to understand. But do you think it will be a lasting effect? Do you think that the attitudes around healthcare, around nutrition will change sustainably? If not, what can we do to make sure that it does, that this pandemic doesn't go to waste, that we bring lasting behavior changes?
Okay, I think I'll start from mentioning some of the public health and social measures that we've all kind of had to imbibe through this pandemic. The key one is WASH, the importance of water, sanitation and hygiene. And I know that Brian mentioned how hopefully that would impact on AMR. But I'll speak from my experience in Nigeria, for instance. I know at the onset of the pandemic, everybody was told to wash their hands, social distance, and all those things. And you'd expect that all of these things would now be imbibed in the normal day-to-day in the country. However, what we've noticed is the message is people are forgetting the message. Sadly, you go out in public spaces in Nigeria, that message of washing your hands, the use of sanitizers is slowly being forgotten. There's a study we did in 2 states in Nigeria looking at water sanitation and hygiene in primary healthcare centers. And some of the findings showed that despite the pandemic and the importance of WASH in the COVID-19 response, many of them still lack basic WASH facilities. And so what you sense is what I sense is twofold. One, on the public front, it requires continuous communication, continuous driving home of social and behavioral change communications to ensure that a lot of these messages stick. And the importance of hygiene sticks, because it's not just this pandemic. Nigeria is one of those countries where we have children still dying of diarrhea, and that speaks to our level of sanitation and hygiene. And the second one I'd say is government's understanding of the importance of a lot of these social measures. So in looking at primary, secondary, tertiary facilities, ensuring that there's adequate investment in, for instance, sanitation and wash facilities. It's urgent that these things are now prioritized more than ever, because we can't keep on reinforcing these messages after every single pandemic. We had it with the Ebola outbreak where everybody was using sanitizers, but now with COVID-19, we went through the same thing. So we really need these messages to stick. They need to be salient issues that are understood now, and I think going forward in every sector in the health space.
Great, thank you. Thank you for your contribution, Viviane. It's certainly, the time is now, and consistency is going to be key going forward. I'm going to move quickly to Valerian. I'm going to skip the question about the paradigm change, and let's focus on cancer and your thoughts, Valerian, about what has been your evaluation in the rate of disruption to cancer policy progress as a result of the pandemic. What are your insights?
Thank you very much for the question. And I think the pandemic has had a major disruption on not just cancer, but most of the healthcare services, and non-communicable diseases was seriously affected by the disruption of services. I work in cancer control in Kenya, so I can be able to share the experience that we had. And some of the most disrupted services were the routine services, the screening, and also the continuation of care for cancer patients. And where some of these disruptions arose from, there were two major factors. One was miscommunication in the early days of the pandemic. Like in Kenya, for instance, when we had the first cases of the COVID-19 in March of 2020, the initial communication from the health authorities was, a lot of caution, what I can call extra caution, or severe, in quotes, severe caution of requiring, people with chronic conditions and an emergency situation to remain outside the healthcare system. And this, of course, affected most of the routine services that we do, especially cancer screening. Most of these people stayed away. The second factor was actually fear itself. There's so much that people didn't know, even within the healthcare system, and of course, the population didn't know in the early days of the pandemic, and so people tended to stay away, even when they needed some services within the healthcare system. They choose to stay away just because of fear, and of course, they expected that with the cases being identified and being added within the healthcare system, they thought that the risk of acquiring the virus was much higher as they interact with the healthcare system as opposed to remaining at home. So we observed, and this is not just Kenya, it's not just Africa, but in very many regions of the world, there was major disruption of cancer screening services. We saw up to a 60% drop of cervical cancer screening, for instance, if you compare our 2019 performance with 2020. I'm happy to report now that we've seen some recovery, but within this disruption, we've seen, what I can call silver lining, for instance. Some of the infrastructure that has been put in place to tackle the pandemic is actually what we are riding on to roll out our HPV-based cervical cancer screening. So it's not just negative stories. It's from 2021, we're seeing a recovery of not just screening, but also uptake of other services. And of course, this has been contributed to by the fact that with time, the health authorities revised their advisories, and there was better communication that people can still continue seeking services, you can still continue receiving care, and even the healthcare workers were were reassured, and with all the systems were put in place, and so we're seeing a recovery. But we also riding on the same system other cancer-related services. Something else that I think we noted is the importance of communication to patients. Especially patients with chronic conditions, and cancer being one of them. That I think moving forward, we need to recognize that it's easier to patients or the people with information take care of themselves. And forget that traditional view of medicine, which we used to call the paternalistic view of healthcare, so that you have people take care of themselves. And I think as people have interacted and gone through this pandemic, they have realized that there's so much they can do to improve their health. A pandemic came, a disease came that the healthcare authorities reported to the people, but they told the people there's nothing much you can do for you. You need to wash your hands. You need to maintain a distance, whether social, physical. You need to wear your masks. And more than that, the majority of the people, even who were affected by this virus, there's nothing much we could do. And now people are realizing more and more that there's so much they can do to better their health. And I think no other sector benefits from that kind of view than chronic conditions where cancer belongs. And I think moving forward, we need to continue reinforcing that kind of message. That the story of healthcare is not just the healthcare is not just a scientific construct. It's also a social cultural construct, and it's not just about physicians and drugs and vaccines. but it's also about people's lives and their bodies and their, how they live their lives and how they interact in the community. So I think this is one of the gifts that we're going to reap from the COVID-19 as part of the NCD control fraternity, and we look forward to this. So just again, to respond to your question, major disruptions, you see recoveries now, but there's a silver lining that, some of the efforts being put to improve infrastructure, take care of not of this pandemic, but maybe even future pandemics, we can ride on the same to be able to improve care and follow-up for patients with non-communicable diseases, especially cancer. Thank you.
Thank you so much, Valerian. We are fresh out of time, but taking note that we don't have a session after this, I'm going to use some co-chair licensing and steal a couple of minutes. Valerian, I want to make sure that we've given you the opportunity to share what you're prepared to share. Is there anything else that you would like to share with our audience this afternoon? Because you've had the least time before we wrap up.
Thank you. Maybe just use a minute or two to add my voice to the question that you refused to ask me, the one on paradigm shift. So and maybe my answer will be within the context that, we all understand that this pandemic is still an evolving pandemic, and there may be, maybe new changes that come in. We know you have information now that the Delta variant is spreading in Africa. Maybe you've not started seeing the impacts of that yet. And also we understand that Africa is not a country. It's not a uniform region. It's 54 countries with different systems, different, political systems and healthcare systems, different socio-cultural, identities. And also to remember that for a shift to occur, there must be, some inputs. There's a trigger, and there have been triggers in the past. We had another pandemic 100 years ago. We had the Second World War. But for the impacts of that trigger to be felt or to be realized, there has to be other ingredients. And these include concerted effort by the population to move towards change. But most importantly, there needs to be political commitment. And my fear is that the third ingredient is lacking. I think my co-panelists have mentioned that we've had, a whole range of responses, political responses to this pandemic, from skepticism to indifference to outright denialism. And I think that's where we have an issue. The East African countries, for instance, to share with this team in the last couple of days, were reading their budgets. Is usually a concerted effort in the region. And I was just looking a week ago at our budgets in the budget statement for our country. And our allocation for health has stood the same place it has stood for the last 10 years or so, just 6% of the total budget and just around 2% of the GDP. So I'm not really seeing the impact of this pandemic, driving political change or political will to invest more in healthcare. And maybe lastly, to just make a comment on this, we've seen some other regions in the world that the pandemic has driven an end or a movement towards the end of political and security crises. We've seen ceasefires being signed, we've seen political settlements, but what are we seeing in Africa? We see continuing the old way of doing things. We're seeing, crises in all the regions of the continent. Even the Southern Africa region now has a crisis in Mozambique. So it's the third ingredient for us to have a full and sustainable paradigm shift towards supporting health in Africa is the political commitment that I'm so worried with. But I appreciate the role that, health fraternities are doing and what Africa CDC, for instance, is doing. And I hope moving forward, and again, I'm seeing this, you're still in the middle of the pandemic, maybe things will evolve, but I really hope that, the continent learns from this and moves to unsustainable investment in health. Thank you.
Thank you so much, Valerian. Yeah, I guess some people have moved faster and some are still catching up in terms of the political will and the leadership that's required. We've seen various different things happening in various different countries. As you say, this is 54 countries. But I think there are some sectors that's taking a clear leadership and that recognizes that COVID-19 is our opportunity as a continent, as a people, to change and to make sustainable change, to take ownership for our health, to stop the reliance on others. and to start building to the Africa that we want to see. We are so proud as the IFPMA to be supporting candidates like all of you who are just amazing, who are thinking the right things, who are asking the right questions. And we depend on you to continue to do that and to not stop it until we see the changes that we want to see. Thank you very much from us, for each and everyone, for your contributions. We are certainly in a different paradigm. Health is a priority. People are recognizing it, and let's see what we can do and how we can contribute to make it sustainable. Thank you for everyone. Thank you to each of our panelists. Thank you to the audience. I'm going to hand over to you, Adi, for the last word.
Yeah, thank you, Belinda. I was just noting, I think we might have a bit more time on our agenda, maybe for one or two more questions. And there is a question from an audience member that maybe speaks to what you were saying, Belinda. And I have another one, but I'll ask the first one that I don't think has been touched upon at all during this time, from Charles. And he says, with politicians championing the agenda of UHC, what significant role do you think the private sector should play to speed up achieving the agenda? Unless I missed that earlier, Belinda, I don't think. No, okay. So
yeah, that's a good question.
Yeah, so why don't I throw that out, if any fellow wants to throw up their hand, and I'll also just lay out another kind of point that I think picks up from what Valerian was saying, which is that yes, when you look back through the history of time, there are pivotal moments like this that then allow governments to leverage that for a new paradigm shift. We saw that with the first, recorded pandemic, the Black Plague, the bubonic plague across Europe, where you then saw the first kind of workers' rights, or it was called the peasants, labor rights, come to protect the labor market that was there. We saw with World War II, as more women entered the workforce market, there were new laws and regulations put in to protect them. And in every part of the world, actually, so with China, following the Chinese Cultural Revolution, so following a moment in humanity, then there was then a paradigm shift in how care was given to rural medicine. So just the kind of final question to maybe pick up on what Valerian was saying, are there regulations or rules or laws you think that COVID-19 has created the space for that will then allow that paradigm shift to be implemented properly? So two random final questions. If any fellow wants to put a virtual hand up and speak to either of those or any other points, I think we have a little bit of time left. I see Emma's hand.
Yes, okay, so I'll just want to answer briefly, looking at the private sector and what we believe, or what we call the African traditional, medicine and all of that. And one of the things that we have seen that is working is the engagement of the community. Many times when we talk about the private sector, we forget that the private sector is everything else that is not public. And so that means our communities, our leadership around our traditional, medicines and all of that. We seem to have forgotten that we have been able to survive different crises as Africans, relying on our own traditional way of doing things. And so we have a term in our cultural dialect called Sankofa. Sankofa means go back and pick it up. So I believe that we are in a crisis that allows us the opportunity to engage the private sector in different ways, including our communities, including our own African traditional medicines that have helped our people all these years. So again, the opportunities are there. It's a win-win opportunity for us to include different aspects of preventative health programs within our community structures and leverage on these structures. It's cost effective. We don't need external funding to do some of these, engage some of these practices. And so we need to really reflect on how we can do this as Africans. Thanks.
Thank you. If no other.
No, thank you, Adi. Let me just taking on your second question. That's what laws, what in public health can this pandemic help strengthen? Clearly, we need a continental medicine regulatory agency that can be able to take decisions on standards and regulation of medicines and medicines products. For instance, in Europe, we have the European Medicine Association agency that could decide what's the minimum standard for drugs coming into the European Union and even for those produced in the EU. Now we have a situation in which even when a company is producing drugs and medicine products on the continent, they are not being patronized. They are not being patronized by our development partners because they can't just guarantee the quality of those products. And if we can't go anywhere without having that kind of agency that will give people the confidence to say that if vaccines are produced in Ethiopia, for instance, that these vaccines meet the best international standards, and these vaccines can be procured by WHO, by UNICEF, and distributed across Africa and beyond for use of our population. So what we need a continental agency, and I think the African Union has the African Medicine Agency in the pipeline, and that we need to support that institution to be strong, to come out very strongly from this COVID-19 and be a driver for Africa local manufacturing of vaccines and other medical products. Thank you.
Thank you. A new African-wide medical agency or authority, we heard it here first. And Belinda, I wonder, given your experience in the pharma industry, whether you might have a view on that. I might just come back to you and for some other closing thoughts after we hear from Adesola and Viviane in that order, please. And just very quick remarks. Thank you. Adesola, yeah.
All right, thank you. There's a question in the chat asking, let me just read, looking at planning ahead, do you think COVID has stimulated or emphasized enough importance of government to plan for emergency health threats? So I want to say that I think in Africa, we are very good at developing documents, planning, we have these things documented a lot. Usually at the point of implementation is where we usually have issues. So I would say that COVID has stimulated preparedness. Of course, like we have all said, there will be now a need for more engagement, especially politically, and also even within our technical institution for the implementation of all the preparedness plans that we have, the ones we have on the shelf already. We need to ensure that these are implemented, and political support is very much needed. But we have it, the plans are there. Thank you.
Thank you. Viviane.
Thank you. I just want to hopefully make a very, very quick comment in terms of the paradigm shift that Amma and Abdulaziz were referring to. I think, if anything, I hope that this pandemic really focuses the African continent, I know we're not one country, on the importance of science and the importance of research. I think one of the things that happened at the onset of the pandemic was people understanding the necessary medicines and therapeutics to respond to it. And I know there's a lot of call for using traditional medicines and going back to our previous ways of doing things. And I'm really glad that Abdulaziz mentioned the Continental Medicine Regulatory Agency, because I think cast your minds backwards. Many of you remember the Madagascar cure, which everybody was talking about at a certain point in time being like the way out of the COVID-19 pandemic. I think if anything, what this has shown us is, as a continent, we need to focus more on the science of responses and on research so that we, again, as I said previously, are not left on the back foot. And, as a country, Nigeria, one of the most populous countries on the continent, investment in science, going back to primary school, secondary school, really needs to be re-emphasized so that we are more self-sufficient as a country and as a continent to understand how we can use science, to understand how vaccines are made, how the response is driven by science, not by speculation or cures that don't have any scientific basis. Over.
Thank you, Viviane. Really, yeah, really strong point to end on. Belinda, if you can, yeah, sorry to extend a little bit. I think we did have a little bit of time just to have a few more questions. So yeah, back to you, and then I'll wrap up at the end. Okay,
no problem. Yeah, I want to just hone in on the African Medicines Agency. What we see as an industry is just the importance of an ecosystem that supports healthcare. And that is built on a functioning regulatory agency. We have various different ones on the continent. I think there's still 7 or 8 countries that we need to ratify for the African Medicines Agency to come into existence. So that is going to be key for so many processes, whether it's local manufacturing, research, clinical trials. If that is in, as we see, with the European Medicines Agency, there's so many things that can then be done in healthcare. So the pandemic is once again a wake-up call. It's an opportunity. Let's collaborate, and we see that. We see agencies collaborating. We see people working together like never before. Let's put these systems in place. So that we can, stop being self-reliant. Let's use the paradigm, the shift that has happened to move forward as a continent. Thank you.
Thank you, Belinda, and thank you for being such an excellent co-host with me, guiding us through this conversation. Thank you to all the fellows for giving up their time and answering our questions and really engaging a thought-provoking discussion on the new paradigm shift. With thanks as well to the World Health Summit Uganda team for creating this space for this discussion. And also thanks to IFPMA, strong supporters of the Chatham House African Public Health Leaders Fellowship. Really appreciate their support over the years on that. So I think we're out of time now, so I will draw this to a close. Wishing you all a good rest of the day, and with hope for the new shift in paradigm ahead.